Welcome everyone to the first Region 4 Planning and Policy Council meeting of 2021. We have been doing this for almost a year now, virtually, so we're all pros, right? My name's Kirby Fye. If you joined via computer, I'm listed as Amy Holland, but this is Kirby Fye with the department. I just have a few things to go over before we get started. The first being that this meeting will be recorded, or it is being recorded, and will be posted to the department website within the next day or two. This is per Governor Lee's Executive Order 71. With that being said, if you can please just make sure your phone and or computer is muted if you're not speaking, just to prevent any feedback from coming through, that would be really helpful. Also, I know we're going to have a big discussion today about the needs assessment, so I'm sure there will be a lot of participation. If you could please just state your name before speaking, this is very helpful for the minutes. I'm going to go ahead and go through the attendance. I'm going to start with the individuals who have joined via WebEx or whose names I've received already, and then we'll go to the call-in users. So like I said, this is Kirby Fye with the department. We have Angie Thompson, Avis Easley, Elliot Pinsley, Heather Vestal, Jennifer Jones, Jessica Singer, Kubra or Cal Bryant, Robin Nobling, Rusty Totten Emerson, Susan Mee, Lily Ross, and I see two call-in users that didn't state their name earlier. Can you please state your name?
My name is Patient Mead, and I am an advocate for TDMHSAS.
Did you say your name is Patience?
Yes, ma'am.
Okay, I just want to mark it on here. Welcome, Patience.
Thank you.
Hello, everybody. I'm Rama Mohammed from Park Center. I am the second caller, I believe.
Hi, Rama.
Hi, Kirby. How are you?
Good. How are you?
Pretty good, thank you.
Did I miss anyone that I didn't get your name earlier? All right. Well, I'm going to hand it over to you, Robin and Angie.
Thank you very much, Kirby. And as far as those that are on the call, Rusty, if you, I think we may do at the very end of the call, we may do another roll call just to make sure we're picking up everybody for the meeting minutes next, go around. Welcome, everybody. We really appreciate you being with us. Yes, we are all getting used to Zoom and WebEx and every other format that there is. We're getting pretty comfortable with this, and we've learned to be really forgiving with each other when we need to be. So that's just fine. Appreciate you all coming with us today. This is the regional council meeting for Region 4, which comprised of Davidson County. The primary focus, and one that this group has agreed to take on, is needs assessment, but we do have other things that we are involved in. And as we go through our agenda today, we will be looking forward to hearing from people who are participating. So if you are new to us, welcome. We are a membership requirement organization. And so we do enjoy having our visitors. And if you have not a formal member, we would invite you to be so. There is some minor process. We can send you out a membership application, and we appreciate representation from people with lived experience, family members, providers, and advocates. So today, I would like to go ahead and look at our minutes from the last meeting. They were sent out fairly late this morning. Could you, and is there any way we can see more of you on the on the screen? Those of you that are not call-in, Kirby, do we have an ability? I know with Zoom we do, where we can ask people to share video. Thank you. I know some of you may have other things to do and maybe trying to get them done, and I understand that. But if you could do that, it helps us to know who's engaged and who isn't. So, so if you can do that with the screen, we'd really appreciate that. Because we may be asking for show of hands at times. So has anyone had an opportunity to view minutes? Have you had opportunity to view the minutes? They did come in. Gosh, it's nice to see you so colorful, Rusty. So they were sent out rather late, but they did get out to you. And so if anyone has had an opportunity to view those and would like to take a minute to look at them, and I'll give you just a minute, and then I'm going to ask for a motion for approval. So I'm going to ask if we have a motion to approve the minutes from the last meeting, which was held actually in October. Would anyone like to make that motion?
I will make a motion.
Thank you, Kubra. Would anyone like to second that motion?
I will second that motion.
And who was that? Was that you, Willie? Okay. Willie Sharon Ross, thank you. Do we have any discussion? Were there any changes, anything that needed to be done, any concerns? So rather than ask you to vote for the minutes, I'm going to ask if there are any objections to the motion to approve the minutes. Hearing none, we'll take that as unanimous consensus. Thank you. All righty. All right. Our quarterly reports. Kirby, could you fill us in on what's going on there with the department, please?
Sure can. All right, so just a few updates, but important ones since our last meeting in October. Most importantly, I guess, not most importantly, but most pertinent, I guess I would say, is the 2021 needs assessments, which we'll be working on today. Those worksheets should be completed and submitted back to me via email on or before April 15th. Typically they're due April 1st, but we pushed it back 2 weeks this year. So please make sure you have those completed and sent to me by April 15th. And please make sure to also include data to support your region's identified needs. The department is pleased to announce the release of the FY21 Creating Affordable Housing announcement of funding. The department is seeking proposals from agencies and organizations throughout the state of Tennessee to develop new, safe, quality, and affordable permanent housing options for individuals experiencing mental illness, substance use disorders, and/or co-occurring disorder. An additional focus of this funding announcement is for individuals ready for discharge from one of the 4 regional mental health institutes, including those who are uninsured. Completed proposals are due by February 5th, and more information about this announcement of funding, including a question and answer section, can be found on the department website. And I've included a link, which I will share these with you, Robin, after the meeting, so you can send them out to your council members. The FY20 Joint Annual Report between the Planning and Policy Councils and the department is completed and has been posted to the department website. I've also included a link for where you can directly access it. I encourage you to check it out if you have the time. The Joint Annual Report focuses on accomplishments, not only within the department within the past fiscal year, but also among the regional councils. And you will find Region 4 in there as well. So I encourage you to take a look at it. The department is receiving a new federal grant to expand the system of care across Tennessee network. The 4-year, $12 million grant from SAMHSA expands SOCAT services to 13 new rural counties for service availability in all 95 Tennessee counties. Over the past 3 years, SOCAT teams across the state, utilizing high-fidelity wraparound services, have been able to maintain a 90% success rate of keeping children, youth, and young adults in their homes and within their communities. In the application, department grant writers focused on rural and distressed areas of the state, and counties receiving services under the new counties receiving services under this grant include Bledsoe, Clay, Fentress, Grundy, Hancock, Hardeman, Jackson, Lake, McNairy, Morgan, Perry, Scott, and Wayne counties. And the mental health providers involved with this new SoCat expansion include Frontier Health, Helen Ross McNabb Center, Mental Health Cooperative, Pathways Behavioral Health, Professional Care Services, Tennessee Voices, and Volunteer Behavioral Health Care Services. So that's really exciting. The department, as well as the Department of Health, kicked off a new campaign centered around the risk of drug overdose and suicide during the winter holidays. The campaign, called Resilient Tennessee, focuses on building resilience and strengthening community connections to prevent the tragic loss of life to overdose and suicide. Behavioral health experts worry the climate around the COVID-19 pandemic may worsen the rise in overdoses traditionally associated with the winter holidays, and could also result in increased deaths from suicide. Through media messaging around overdose and suicide prevention, social media outreach, and virtual trainings and events, the Resilient campaign seeks to empower Tennesseans with the tools and knowledge to overcome the personal challenges they face, watch out for and help those around them, and emerge on the other side stronger than ever. I encourage you to check out www.tntogether.com, which includes a calendar of events as well as other resources surrounding the Resilient Tennessee campaign. And last but certainly not least, the department is receiving a new federal grant to expand criminal justice alternatives for Tennesseans living with addiction. The $6 million grant from the U.S. Department of Justice will cover 10 project sites. Services under the grant begin with a collaborative community review of services under a standardized model called Sequential Intercept Model Mapping, otherwise known as SIMS. The county-specific report is then used to prioritize needs and make decisions about additional funding. The new grant builds on a previous $6.5 million grant from the Department of Justice that is currently serving 11 Tennessee counties, including Davidson County. Additional strategies employed by the grant following the SIMS model include law enforcement and other first responder diversion programs for people experiencing substance use, embedding social services with law enforcement in order to rapidly respond to drug overdoses, and evidence-based treatment such as MAT or medication-assisted treatment, as well as recovery support services, including transitional or recovery housing and peer recovery services. And that is what I have.
Thank you very much. There's some really heartening things going on there. I'm very pleased to hear about the SoCat expansion and some of the other things that we've got going on. And we do need to let people know that Avis had sent out and Nehru Govan had sent out information on housing that is some opportunities for grants, and those are going to end very soon. So when we send those out to you, just try to latch on and contact those individuals that will have more of the details for you. So thank you. At this time, we'll go ahead and check in with our MCOs, and we'll start with Kubra Urkel Bryant to ask her to give a report on United Healthcare. And Kubra, we got you. No, you're not.
We can't hear you, Kubra.
You're not muted, but we can't hear you. You're not showing us muted. No.
No, we can't hear you. But you're not muted.
Huh.
This is Elliot. I had the same issue when I was on the WebEx application and I unmuted and no one could hear me. So I'm on my phone talking. So there may be something wrong with the meeting.
Oh.
Okay. Thank you. Yeah, because Cooper, we're getting no sound. It's not that it's low. It's no.
She said, go ahead. She'll start solving it.
That sounds fine. Do we have anybody here on the call? I don't think I see anybody from either Blue Care. Cooper, want to try again? I heard something. From either Blue Care or AmeriGroup. All righty. Okay, and Cooper, whenever you're ready to try, just let us know. Okay, still not getting you. You might have to call in to get sound. And so I'm going to keep going. If you whenever you get connected, we'll pop over to you as far as sound. Okay, thank you. I don't believe we have Servine on the call today, and she is our Children's Committee rep. I'm wondering, I don't see either Evelyn Yergin or Shara Biggs for our Adult Committee. So, so that will make those things short and sweet. I do know that the Adult Committee, I know that they have gathered. I know that they have gathered and they have some topics that they have discussed. They were supposed to get together to see what they wanted to really truly focus on.
Can you hear me now?
Yes, beautifully. What did you do?
I took my headset off. Maybe it was that was the problem. I was just saying that we're just continuing with our telemedicine as usual for United Healthcare, and we're working with TenCare and trying to learn all the changes they're bringing across and working with our providers. So if you have any questions about the new TenCare regulations that will be coming into effect next month, please contact me and I will put you in contact with our executive director. He will be very happy to clarify things if you're confused about anything. Also, we are still sponsoring in the community. We're still supporting and providing sponsorship for events in the community. Please contact me for anything that's going on. And we will carry on as usual, as if there's no COVID, and do everything virtual with you guys.
Thank you very much, Cooper. We really do appreciate that. Do we know of any central point of, and perhaps Elliot could speak to this, of information for those TenCare changes?
I do have a website of the block grant. That's all I have for TenCare.
All right. I think
so. If you need that, I can share that with you. But I'm sure Kirby can share that too. But I'll be happy to if you would like me to.
All right. Thank you. And so thank you for that report. We appreciate that. Elliot, I know that the Legislative Committee has been active. Would you catch us up to speed on what's going on and your new members?
Absolutely, yes. We do have a new member that has joined our committee, which is great, and we are slowly growing steadily but surely. We have decided on a quarterly schedule going forward for our committee meetings, and I'm going to be sending out an email soon to those of you who are involved and are waiting on that. And it looks like we're likely going to be doing first Thursdays at 1 o'clock in March, June, September, and December. So essentially the month after we have these meetings here. So we'll get some information out to Robin so she can distribute to anybody who's interested. And we would love anyone who's interested in our legislative committee. Our primary objective is to work on legislative proposal ideas for submission through the statewide Planning and Policy Council process. However, you don't need skills or knowledge of how to write policy or legislative proposals. We are looking for anybody that has any ideas or interest in learning or has a suggestion on something we could follow or wants to do some research. So anybody who is interested, please reach out to me or Robin, and we'll definitely get you on the list for those announcements going forward. Beyond that, there is, of course, we're in the middle of a legislative session, and there is a lot going on. There is not a ton of legislation this year related directly to mental health, behavioral health, given the fact that we are in this odd year in pandemic and people are expecting that budgets will be tight. However, of course, there was a report from the Sycamore Institute that just came out, I'm not sure if it was yesterday or today, that announced that our state may be looking at an approximate $3 billion revenue surplus in the general fund that has not yet been allocated for FY21 or 22. So there could be some funds available to be spent here shortly, what decided on by the governor and the legislature. So that is a little bit exciting. I want to bring attention for everybody to, of course, the 10-Care 3 block grant, I say block grant with air quotes, I wish I could show you here, but it is not a block grant by any means. It is a different type of mechanism. There's a lot of controversy over this. I'm not totally comfortable with the way that a bunch of rules were broken to pass it with little public input. However, this was expected and was a partisan move to move in a direction that was already approved by the legislature before the pandemic. This essentially just changes the way 10-Care is done, gives Tennessee a great deal of oversight, a control that, and without having to go back for oversight in many ways from the federal government, from CMS. So there is a formulary restriction. That is one of the most controversial elements this group should be aware of, where they're limiting, they have the ability to limit covered drugs to one per class. And that is yet to be defined in how they're going to do that here. But that is a flexibility that is the first of its kind in Medicaid anywhere in the country. Good news is that there are some carve-outs. Opioid use disorder drugs are carved out. You've also got anything related to the protected drug classes of Medicare that are also carved out. So those remain protected. Antidepressants, antipsychotics, anticonvulsants are included in that group. However, of course, a one-drug formulary poses all sorts of different consequences if not managed in a productive way. So that's something, an advocacy point to keep in mind. So there's a lot to cover there. I've done a lot of analysis on the block grant, again, in air quotes myself. It's called 10-Care 3 and is in the process of being implemented. The Biden administration is also looking at this and considering potential reversal from reports that I've been receiving. So if anybody has specific questions related to how that impacts behavioral health, I'd be more than happy to talk with you after this meeting when more time allows. But that is the biggest piece here. One more big piece is there's a bill that's been filed. It's Senate Bill 151, House Bill 360. That is shoring up mental health parity legislation that was filed and passed in recent years in Tennessee. This is to enforce the federal parity law, which essentially, in a short term, for those who are not familiar, it means commercial insurers, and also it applies to Medicare, Medicaid through some rulemaking. They're required, if they offer behavioral health benefits to their members, to cover them on par with the way they cover physical health benefits, meaning there cannot be additional eligibility criteria or hoops to jump through or co-pays that would be different from situations on the physical health medical side. So there's a bill to shore that up to require the Department of Commerce and Insurance to file an annual report. And I'm part of a parity coalition group that has been working with that department, and they've been making some changes to make a complaint form more available. So parity is a complex subject. We've talked about it years ago in this group, but if anybody has questions about that, has potential parity complaints, I'd be more than happy to talk to you about that further. So without further ado, I want to say one more thing that's currently on the table in the 10-Care budget proposal. Every department had to propose a cut of some sort, and the Department of 10-Care, Division of 10-Care has proposed 2% provider rate cuts across the board. I am very concerned about that. I do not feel like that is the best move, given that we are in the middle of a pandemic and relying heavily on our healthcare workforce on both the physical and behavioral health side. And a 2% cut, I'll just say, frankly, feels a bit like a slap in the face, given everything these providers have done over the past year and the fact that our workforce is struggling mightily right now. So I think that is something that we can all hopefully get behind as an advocacy point to say that this is something we'd hope to be changed into a different cut if a cut is truly needed, and that those rates are not diminished in any way. So that is my update. Is there any questions that I can answer briefly, Robin, or from anybody else?
No, but what I would like to do, thank you. If we don't hear any, we'll give it another second here. Those of you that are serving on that committee, would you give a quick shout out and tell us your names?
Jennifer Jones.
Thank you.
Susan Me.
Thank you, Susan. Anybody else on the call? I know there's more people. They may not be on the call today.
Well, I know Angie, of course, participates when she can, and Robin as well when she's able. Yeah. We have a few others that are not mentioned here, and a new member. So it is a small but mighty group, and our region has put forward some of the most productive proposals across the state in recent years. So honestly, it started with I had an idea or two, and I wrote them down on pieces of paper and asked for permission to submit them, and we did it, and they got heard and resulted in formal work groups or collaborative discussions or presenting to the commissioner an idea. So if anybody has an idea and wants to move it forward, please don't hesitate to speak up and reach out. Thank you.
All right, and I see Tristan has come into view, and we have him on camera, and so I know you've expressed some interest in that. And so, guys, I want to let you know that there are several groups going on right now, the State Coalition, the Parity Group, that are doing some much deeper dives on some of these issues and doing some excellent work. What we may ask you, and certainly with me, being with NAMI, this is a big part of what we do. It's a big part of what TMHCA does and TADIS. We may come out to you and say, from the various groups, please help us with this. We're all very concerned about this 2% cut to TennCare. The other thing that was good to hear this morning is that the state revenues are $3 billion above what they thought they would be. So let's keep fingers crossed to see if everything works out. But if we need you, we will call on you to be our voices. Thank you very much, guys. And thank you very much, Elliot, for all that's going on. Again, if you want to reach out to Elliot, you can do that. Elliot, would you please give your email address, the best email address to reach you?
Yes, my email is Elliot with 2 L's and 1 T, so ELLIOT at behavioralhealthfoundation.org. It's spelled behavioral in the American way without a U there. So Elliot at behavioralhealthfoundation.org. Thank you.
Thank you very much. All right. So on to the meat of the meeting. First of all, I want to give a shout out to both Julie Thacker and Angie Thompson, who have been instrumental with myself. And last time around in October, it was also Heather Snell in helping us to process through the issues, identifying issues for the needs assessment. So needs assessment, for those of you that this may be your first go around, needs assessment is the work of this group identifying where we're lacking, what services are lacking, what don't we have. And we usually are doing this against the department's 3-year plan. So as we do the needs assessment, we are looking for where the gaps are. What do we still need? And these can be things that we have identified in the past that we just may not see that they have gotten better, or they haven't gotten better to the point that they're not still an issue. So we're going to identify them. We identify them as mental health needs and substance use needs. We know that these can overlap, but we will define them in those 2 ways. We may also, if we have some things, if we come up, our goal today is to get down to 2 each identified, 2 each for substance use and for mental health. If we have some layover, holdover, if there's an issue that we know that would just be suited to adults, or an issue that is best suited to children, we will identify those after we've come across with the 2 for SU, as I'm going to call substance use, or MH for mental health. We can then take those and use those to submit for the adult committee and for the children's committee. We went as a group last November, and with Julie's leadership, we distilled this down to a list. That list was sent out in the survey, and I know Angie is prepared to help us with that right now. We're going to take the list of what you gave us, and we distilled it down. Julie, myself, and Angie distilled it down into commonalities. If it was housing, but it was all pretty much the same issue on housing. So we got it down to some groups. We want you to help us winnow that down further. And then from that, we're going to try today to go ahead and develop the 2 needs that we are going to put forth to the department. So,
Hey, Robin.
Yes.
Hey, Angie sent me a link. So when I click on the survey link, it's access to the survey. Is that what you want me to share?
Actually, I think, Angie, I have the actual, and Kirby, I think I sent this to you earlier, which is
Yeah.
the Region 4 Mental Health Substance Abuse Needs Assessment, and it's got the list.
Do you want me to share that now?
Why don't you? And Angie, you take a look at that and make sure that's aligned with what,
Okay.
because it's directly from what we developed.
It was, what was it? Let me just clarify. It was what was sent out in the survey?
This is, yes, it is. It is. This was the list that was used for the survey.
We actually distilled that down into some categories. And so I didn't know if we wanted to try to use the categories that we sent in the survey. That's what I was asking Kirby. I just sent you the link in that email. That's what I'm wondering if you can put that up. I'm sorry, y'all. Julie, that didn't work out for today. I'm trying to pitch hit here. So apologize for confusion.
Sure. Let me see here. I know when I click on the link, it takes me right to the survey.
Right. Can you put that up? Can you share that screen?
Yeah. Hold on one second. Okay. Technology, fun times. Okay.
Look at it.
So let me just explain the list that's in your packet. That was the raw information that was gathered the last time we met. And Julie, myself, and Robin met to try to distill those down into some commonalities of issues. And that was what was sent out in the survey that Robin sent in the email of January 29th. We had very, very limited response to that. So we thought we'd just put the survey up here, talk through these, and we can flesh out details under them. But if we can simply look at these components, and I guess, let's see, you're going to have to move this up and down, I guess. I can't do that. Yeah, if we can get pretty much all those on one page, that'd be great. So what we did is basically we segmented them into two sections, looking at the mental health versus the substance abuse sections. And so the way those segmented out were the initial list on mental health. I'll just read it down so for those of you who can't see it. Or if you have your January 29th email from Robin, you can click on the link and look at it as we're going through it too.
Yep.
So just to give you all the overview, these segmented into social engagement for those with mental health issues, support for children and parents, incentivize diverse recruitment into workforce, data regarding behavioral health workforce shortages, older adults with mental health and physical health into the right support, and that should say housing, expanded mobile crisis services and outreach, same-day access to outpatient therapy through traditional and non-traditional mental health services, increased reimbursement for providers, increased reimbursement for housing providers, management of realignment of resources to reflect the acuity and complexity of the issues, expanding mental health recovery housing with support, education and support around trauma for law enforcement, increased case management and peer support, and housing for those with co-occurring intellectual disabilities and mental health needs. So since we had limited participation, I'm going to focus on this mental health piece first. If you all will take a minute, I'll give you all just a minute. If you'll go through those individually and just pick out your top three, and then we'll start to discuss each of those and see where we've had the greatest alignment. So is everybody clear about what we're doing at this point? Or do I need any further explanation?
And Kirby, is there any way you can shrink that a little so all of the, if you go up into your upper right corner and make your screen at say 90% rather than where the 3 dots are. There you go. And go where it said, yeah, and bring that down. So there we go. Maybe, oh, not too far. A little bigger. That's a little.
There we go. Oh, that's got it. That's got it. We've got everybody.
You guys see that? Okay. There we go. Okay. And so like Angie was saying, the top 3 out of, you know, if you were to rank them, what would be the top 3 that you would pick out of here? Angie, what might be easy is to ask everybody to number 1, 2, you know, they're 1, they're 2, and they're 3, and then go down and see how many that number 1s we have for each category.
Right. Yeah.
Okay. All right.
I have a question if for any. Oh, sorry.
Go ahead.
Go ahead.
I just was going to ask a question quickly if there's any providers on the call who care to answer. I know across the state, workforce shortages are just absolutely crushing in many areas. Are providers here in Region 4 experiencing major workforce shortage issues?
I would say so.
I would think so too. I just wanted to hear from any providers who cared to share if there were any here.
Hey, it's Shara.
Okay.
I would venture to say yes. I'm not real closely connected with our clinic services to know that the day in, day out stuff, but in conversations, it almost always comes up that there are staffing challenges for nurses, nurse practitioners, and psych providers.
Thank you, Shara. This is just a huge, for the group. There is no strategic plan at the state level for this. There's a bit of it's a little tricky because health providers are licensed under the Department of Health, which is not under the jurisdiction of the Department of Mental Health. And these are some major issues right now, and we need to start working on it. So our group put forward a legislative proposal too, and I know the Department of Mental Health is waiting until the Department of Health has some more time to discuss it. So it's a major need from my perspective.
I appreciate that. So let's go ahead and let everybody do their 1, 2, 3s, and then we can have our discussion.
And if I might say too, 1, 2, 3 does not mean that is your first, second, or third choice. Just pick out your top 3, and then we'll number those. We'll get those, and then we'll go for then we'll prioritize within those to reach our top 2. The first thing we're just trying to look at is where's the interest.
Yeah.
Okay, since I can't see everybody like I would if I was typically facilitating in the room, is everybody pretty much got their top 3? Does anybody need more time? Just press the button, tell me if you need more time, if you can unmute and tell me.
Hey, Angie.
Yes.
My illiterate tech stuff, I don't know if it's because I'm on my phone, but I'm not having any luck choosing options.
Oh, you don't have to choose the options. Just tell me. You're going to have to just tell me what they are. Okay.
Oh, gotcha.
This is not because the way the survey's been shared. It's not live.
Okay.
You're just going to have to tell me.
Okay, no problem. Thank you.
I have a question.
Okay.
What is same-day access to outpatient therapy through traditional and non-traditional mental health supports? Can you clarify what non-traditional is?
Hold on, let me go back and look at this.
I'm wondering, Angie, one of the things I see is that we had listed maybe telehealth services.
Yeah, I think that's it. Telehealth. You're right.
Telehealth.
Yeah.
I think
Okay.
that was. Yeah.
Now, how would they go about doing that? Are they?
Well, this is what we're saying. Is this something that we need to look at as a need? We don't have if it turns out to be one of the top 3, then we'll fatten that calf.
Gotcha. Sorry.
That's okay. No, that's a perfectly good question.
And I'm wondering if we could get, let's see, can we do the hand raise on this to have you vote kind of thing? And then we can just count the hands. Is there somebody that can count the hands for us?
And Kirby, we should be able to do that, right? Going down to the bottom.
Yeah, I'm going to have to stop sharing for 1 minute.
Okay.
Okay. Yeah, you are going to be, and you're going to be able to do a thumbs up, guys.
Well, let's let people do the hand raise on the screen on the side, because everybody's not on, so I can't see who all's a yes or no.
Where is the hand raise on the side?
If you go to where your name is and hover over your name, your little hand will come up. And if you click on that hand, that means you've raised your hand.
Don't
say raise hand and just click that, and then we'll be able to see how many people voted for the first one, and we'll count that number, and then we'll go to the second, third, and so you'll put your hand up, you'll take your hand down. Does that make sense to everyone?
It does. If I could,
I can't see it over my hand, my name.
I don't have it either.
I'm hovering over my name and the hand doesn't pop up.
That's why Angie was going to suggest on the reactions on the bottom where the smiley faces, they could hold the thumbs up like that.
Oh, that's fine. Tristan's figured it out. Okay, if you don't know how to do it at the bottom where you see the smiley face reactions, you can do thumbs up.
Okay.
Does everybody have that? And people on the phone will just have to catch yours separate. Does everybody see the reactions, and will that work?
Yes.
Thank you, Tristan.
Quick question. This is my first meeting, and I'm not technically a member yet, but I do plan to continue coming to these. Would you like me to vote, or would you like me to hold off?
I would say that we're not. This isn't voting. This is a needs assessment. We are, and we'd like everybody's input into the needs assessment. When we do voting for official things like minutes, that's when you're not able to participate until we've got you as an actual member.
Okay, perfect, thanks.
But yeah, thank you. It's a good question. And so Kirby, we're going to have to take that down. Ange can go through and read each one, and then she's going to have to be able to see the reactions.
Okay, what I'm going to need you to do, Robin, I'm going to need you to be able to count reaction for me.
I sure will, and I need Kirby to bring the shared screen back out of the shared screen so I can see people and see reaction. And those of you on the phone, and so guys, those of you that don't have camera, I don't think we can see reaction. So we need you on camera. So Bree and Elliot, Patience, Heather, Evelyn, and I understand, so we need you guys on camera.
Hey, Robin, I have a point of order actually here. I did not see a change from the department's recommendation that none of us be on video since these meetings were being recorded. Has that guidance changed?
Oh, well, I'm only doing that to accommodate being able to count reactions.
You can, I believe you can still count reactions without video.
Thank you.
You can.
Thank you, Elliot.
Mm-hmm.
Thank you. All right. Okay, go.
Okay, you ready for the first one? Everybody ready?
Yeah, social engagement.
Okay, the first one is social.
Question?
Yes, this is Rama. I'm on the phone as well. Can I just make a comment through the phone, or I have to be on a computer?
No, you can make a comment through the phone. We'll just add you.
Robin, this is
right,
Avis. I was going to suggest that for folks who are not on the computer or video that are on the phone, if if you're gonna do it this way, the folks that are on the video, on the camera, or who can do the thumbs up, since that's the way you're doing it, let them vote first and then take a vote for the people that are on the phone. I think it's about 5 or 6 that's on the phone at the end, and they can then verbally tell you. That way everybody has an opportunity to vote.
Sounds good.
That's a great idea, Avis. Okay, so what we'll do then is if you're able to vote by reaction, thumbs up, thumbs down, we'll do that. Or just thumbs up. You don't have to do thumbs down. If you're able to vote on the screen with a reaction, do that. If you are on the phone, once we finish the voting, going through each of these, then we will poll you and add your vote to that, okay?
Sounds great, Angie.
Okay, perfect. Okay, so the first one is social engagement for those with mental health issues.
1, 2, 3. I'm going to add myself to that. 4. And maybe
Keep it up. Keep your reaction up until Robin finishes, please.
And Kirby, I want to make sure I'm seeing everybody. So the last person I see on the screen in the lower right corner is Sharon Ross. Does that represent everybody on the call?
Yes.
Because there's about 20 people,
okay.
yeah.
Okay, good. All right. And so I am seeing Jennifer, Jessica, I believe Evelyn, and then myself. So we got 4. Okay. And then anybody on the phone that would like to be counted for social engagement.
I would like to be counted for social engagement. This is Rama.
Thank you, Rama. Okay.
This is Heather Vestal. I would also like to be counted.
All right. Anybody else?
This is Patience Need. I would also like to be counted.
All right. All right, we got everybody? Next.
Okay, the next one is support for children and parents.
C2, C3. I've got 3 on video. Anybody on phone?
Okay, the next is incentivize diverse recruitment into workforce.
I saw Cooper. Was there anybody else? Okay, I've got 1 video. Phone. Okay, nobody by phone? All right.
Next is data regarding behavioral health, workforce, and shortages.
I'm seeing 1. Okay, anybody else? 2.
Sharon.
Okay, I've got 2. Anybody by phone? All right.
Okay. The next is older adults with mental health and physical health into the right support and housing.
1, 2, 3. We've got 3 so far. Anybody else? 4, 5. Okay. 6. All right. Okay. All right, so I'm seeing 6.
Do we have anybody on the phone?
Heather Vestal.
All right. Anybody else besides Heather on the phone?
Rama Mohammed.
And Rama, okay. And one more time on the phone, anybody else? Okay. Okay, all right. Next.
Next is expanded mobile crisis services and outreach.
We've got 3, 4, 5. Anybody else on video for expanded mobile outreach? All right, by phone? Okay. Anybody on the phone want to do expanded mobile outreach? Okay. Next.
Next is same-day access to outpatient therapy through traditional and non-traditional mental health supports.
1, 2, 3, 4.
We may need a reminder that everybody's only supposed to vote 3 times.
Thank you, Elliot.
Because I'm seeing more than that. Thank you.
Yeah, your top 3. Same-day access outpatient video. Could we do that again, please? I saw a couple of them.
Yeah.
Same-day access 1. Okay. Same-day access outpatient, I believe. Tristan, you're on a camera, but I thought you were one of the people for that. Did you, Tristan, did you want same-day access outpatient? I see Angie. Okay.
I think I went over quota.
Your limit. Okay. Is this more important to you than one of the others that you did?
I don't remember the other ones.
Okay, then I think we're going to sit where we're at then. I believe we have 2 on this for video. And anybody on phone? Okay. Next, please.
Increase reimbursement for providers.
Okay, 1, 2. All right. Anybody else? I see 2. Anybody on the phone? Okay. Next, Ange.
Increased reimbursement for housing providers.
I see Shara. Okay. Anybody else on that? Housing providers? All right, on the phone, please. Okay, there I see 1. Okay, thank you. I believe I got 2 on that one. Okay, next one, Ange.
Management of / realignment of resources to reflect the acuity and complexity of issues related to COVID-19.
And any hands up there for video? None? All right. On the phone for acuity with COVID and management of resources? Okay. And next, Angie?
Expanding mental health recovery housing with support.
How many we got here? I think I've seen 4. Am I missing anybody? All right. And on the phone? All right. Next.
Education and support around trauma for law enforcement.
Love that. All right. Anybody on the phone with that one?
Heather.
Heather, thank you. Anybody?
Rama.
And Rama. Okay. Okay. And keep in mind, guys, you're trying to do your top three. All right. Next one, Ange.
Increase case management and peer support.
To be clear, to me, those are two very different issues if we're talking about needs assessment.
I understand that's the way they fell out in the initial thing. So let's just get through the prioritization, then we can go through the discussion.
Yeah. Yeah. Because if case management, if either one of those doesn't pop up as one of the top, that we're going to do, that we don't want to take the time in discussion. So I saw 3 on that one. Okay. And on the phone? And to be on the phone for case management on the other. Okay.
And the last is housing for those with co-occurring intellectual disabilities and mental health needs.
Good one. Okay, any response there? And any response by phone? All right. So get this one, this one. And let me put the overall, that's 7, that's 8, that's 5, 4, 2, 3. All right, so our top 3 turn out to be social engagement at 7, older adult supports at 8, and expanded mobile crisis at 5. Yeah, those are the top 3.
Were there any that fell at 4?
There were 2 that fell at 4, and they were recovering housing for people with mental health issues, and education and trauma education for police.
Okay.
Those were the. So the other thing that, and I was just looking to see if either of those. So we need this was mental health side, right, Angie?
Correct.
Okay. All right. And then I was just looking to see if any that fell underneath this we could use. We had 3 for support children and parents, which could be used for our children's
committee.
So we could do that, and the adult committee could use, and Evelyn, I'm going to defer to you on this, but either the recovery housing for mental health or the trauma education for police. You can have 2 in the adult committee, and if you guys wanted to take those on, what do you think? Evelyn, if you wanted to unmute and respond to that, or share it, because I know you're both on that committee.
I would be okay with it. This is Sharon. I would be okay with it.
Okay, so we've got those 2 issues for you guys for adult committee.
Well, let me ask this. We have older adults is number, or, with 8. Would that be more appropriate to go to the adult committee as opposed to the other 2?
That would, if we did that, that would percolate either recovering housing or trauma education for police into that position. So you know, and that is specific to a particular population, whereas the others are broader. So what does the committee feel on that? What is your take on that, guys? I know that, Sharon, Evelyn, I'm going to go back to you again. I know that older adults were part of, actually back when Susan Seaborn was working with Evelyn, part of the concentration that was identified. How do you feel about that, or would you prefer to keep it in the main ask or main needs assessment? Shara, Evelyn?
Sorry, I'm thinking over here.
Okay. And if you guys
still
want
not
to, you know, if you guys want to confer with one another, you know, those of you that, if you want to have a private chat, guys, you know, you can do that in the chat. Just instead of it going to everyone, you can pick who you want to go to. So if you want to have a little bit of quick side conversation, just we can't spend a lot of time doing it. So,
do we have the option for Evelyn and I to chat real quick without holding everybody up?
Yeah, you can do that. You can do that in the shower. You can do that in the chat to each other. Just each one of you would go. You would go look at the list. You go to 2, and then just go to that individual, and you can do a quick chat. But so I'll give you like 2 minutes to do that, and just I'm going to review once again with the full committee. So what we had was social engagement for people with mental health issues came in at number 7. That was the second top number getter. And then the top one was older adult supports. That was 8 people. And then we had expanding mobile crisis was the third one. So those were the 3, with the 2 below them being recovery housing and trauma education for the police department. So so that's where we're at with that. And then we were going to take supports to children and parents, which was kind of vague, and we can do that for the children's committee, and it would probably need to be fleshed out some more. Okay. All right, guys. Did I chat enough to give you your 2 minutes?
Are we going to have some discussion on these before we select? That was my understanding.
We'll have some. I just want to get down to what those are, what the main ones are. Once we get into the main ones, and Angie, would you want to keep the process going that before we start the discussion on the mental health ones that we clarify what the substance use ones are? Because I want to.
Yeah, that'd be fine. And remember, part of this process is we identify these, and then we go in and we look at, you know, where's their data? Is this already being covered? All that sort of thing. So that's the second step of this process, not to be done today, but we were trying to just get today to get this direction, I guess, from the group in terms of moving this forward. So if everybody's okay, we can go ahead and do the substance abuse, and then we can we can discuss those others further. Kind of thing.
That sounds great, Angie.
Okay, all right, let's go substance abuse here.
Okay, same process, guys. And as was stated, it's your top 3, so don't vote on everything.
It had to do something with that AT&T.
Do you want me to share the substance abuse section, Robin?
Please.
Yes, please.
And somebody needs to go on mute. We just heard somebody talking in there. Okay, I'll give everybody a minute just to take a look at those.
Hi.
And somebody has music in the background. If you will mute.
That's elevator music.
Yes, I appreciate the mood enhancer there.
Okay, let's go into. Oh shoot! Hold on, just a minute. I'm trying to cut this off. Okay, let's go on to the quicker access to outpatient care. Now, remember, this was for substance abuse.
Hang on one second. So everybody, take a look at what that is, and Angie will say it, but I'm going to need Kirby to stop sharing so I can see your responses.
Can we just have a moment to look at this? This is honestly the first time I'm seeing this.
Oh, okay. Yeah, yes, Elliot, because you didn't get you said your email did not come through. Absolutely. And these were issues that were brought up in the October meeting also. That's where they originated, was all that discussion.
I have a suggestion. There's 3 items on MAT here. I mean, for the process of voting and shortening our process, why we want to consolidate, and anybody who wants to prioritize MAT could vote for MAT, and then we could discuss.
I think what we did was when we went in and looked at what everybody had given us initially, it was even broader than that, and we got it down to those 3 areas of MAT.
I'm sorry, Robin, I was interrupted. Can you repeat what you just said?
Well, as I recall, Ange, we'd gotten several things on MAT, and we had gotten it down to these 3 different areas of MAT. And then Elliot was asking it, like, could we just group them all together and just have MAT as an issue? But we had distilled it down because we had multiple responses to data on MAT, discrimination by pharmacists on MAT, and authorization removed from MAT, prior authorization. I can definitely see where data is separate. The other 2.
The pharmacist piece is different just because, I mean, there would have to be discussion, because is that something we want to bring up through the chain of the Department of Mental Health, who does not regulate pharmacies, or not? Does that make sense?
Yeah, and so that's why when you're doing your 3, just doing your top 3. So has everybody had sufficient time to view the list? All right, and so Kirby, could you stop sharing, and then we'll do our voting? Thank you. Okay. Angie, if you'll take us away.
Certainly. First one is quicker access to outpatient care.
And do we have any votes for that? 1, 2. All right. Anybody by phone? All right. Next, please.
And Robin, this is Avis. I saw 3. Did you get 3? Because I think your head was down on 1.
Thank you. No, I did not see 3.
Okay, I'm trying to help a little bit.
Thank you, ma'am. I appreciate that very much. Okay, next one.
Did you get the phone vote?
I didn't hear anybody phone vote on that.
Okay.
We asked for it, but
okay. Rapid response to treatment.
Cooper, I saw your personal hand go up. Rapid response to treatment. Anybody on video? Okay. And anybody on the phone? All right. And Kerber, was that was a yes from you? Not sure. Kerber, did you? Okay, I see Sharon. All right. Cooper, was that one of your picks? Was this one? No. Okay. All right. So I've just got one. Next, please.
Residential beds in substance abuse, especially considering social distancing issues.
Okay. All right. One, two. We got two so far. Any more on video? Response to that? Three. All right. I see four. Okay. Any more video response to residential beds, especially with social distancing? All right. I see four. Anybody on the phone?
Yes, Heather.
Heather. Okay.
Yes, Rama.
Rama. Okay. Anybody else?
Yes, patient. Yes, patient.
Okay. All right. Very good. Next one, please.
Workforce shortage.
And all right. Anyone workforce shortage? I see one for Kubra. All right. Anybody else besides Kubra? Sharon. Okay. Two. All right. Any more video? Okay. And on the phone? Anybody? All right. Next question, please.
Law enforcement interactions diminish involvement in crisis calls.
Okay. I see one.
I would support this on the mental health side, but not on this side, just for clarification.
Okay. I've got Jessica. I've got one. On video, two. Rusty. Anybody else? All right. On the phone, please. All right. Last call on the phone. All right. Next one, please.
Data on MAT.
Got one with Shara. Two for Angie. Anybody else? Data for three. Okay. And on the phone? Anybody for data MAT on the phone? Okay. Next issue, please.
Next issue is pharmacist discrimination against MAT clients.
Okay, I've got four so far. All right, up is that four? Now I see five. Okay. All right. Okay. And anybody else on the phone? And that was for pharmacist discrimination of MAT. Okay. All right. And the next one, please.
Next one is prior authorization removed from MAT.
And quite frankly, what I'm going to say about that one is I'd need more information on what that really is before I personally would respond.
That Robin, that would be not doctors have to get prior authorization from an insurance company before they can have their patient get the reimbursement sent over for buprenorphine treatment, for example. So essentially they can't prescribe it just like they would any other first-line treatment. They need prior approval and have to fill out a form.
Okay, thank you, Elliot. On that basis, is there anybody that wants to cite that as an issue of importance to them? Okay, anybody on the phone? Angie? Anybody on the phone? Okay. Next one, please.
Transportation services expand radius for surrounding counties.
Okay, guys, would you keep yours up there so I can see them? So because I know there were quite a few. 1, 2, 3, 4, 5. All right. All right, and anybody on the phone that wants
Heather?
Heather? Okay. This is transportation services expansion. All right. All right, and the next one, please.
Expanding recovery housing with supports.
And I'm seeing 1, 2. Could you guys Evelyn? Okay. Keep those up, please, because I felt a little confused. Evelyn, it's 1, 2, 3. Evelyn, I saw you 4. Okay, recovery housing. Thank you. And on the phone, anybody wanted on the phone for recovery housing expansion? Okay, thank you. Our next one, please.
Grant money for first weeks of sober living.
All right, anybody there for video? All right, anybody on the phone? Okay. Next one, please.
Increase case management and peer support.
Let's see, 1. All right, and I see 2 for video. Anybody on the phone?
Heather?
Okay, there's 1. Anybody else on the phone for increased case management?
And peer support.
And peer support, thank you. All right. All right. And do we have another, Ange?
Yeah, increase reimbursement for providers.
Okay, I'm not seeing anybody there. Anybody on the phone? Okay. Okay, was that our last one or do we have another?
That's our last.
All right, thank you. So we have the top one was the residential beds with acknowledgement of social distancing. So that was the top one. The next one was the transportation, expanding the transportation. So the residential beds got 7 and the transportation got 6. And then pharmacy discrimination for MAT was the third one. That was at 5. And following up to that were, I don't see anything. I'm looking to see if there's anything specific to that you could either use for adult committee. So expanding resources, quicker access to outpatient treatment, and increased case management would be the next ones, and MAT data, but those would be ones that you could use for maybe the adult committee. I don't see anything in here for the children's committee. So adult
Robin, I think the expand recovery housing with sports also had 5 votes based on my tally.
Oh, really? Okay. And was that That must have just been video.
Voted very late there, and I think you may have missed my vote on that.
Oh, thank you very much. Okay. So, so our top two are the residential beds, the social distancing, and then the transportation expansion. And then after that would be the pharmacist discrimination for MAT, expansion of recovery beds, housing, excuse me. And those would be the top 1, 2, 3, 4. And then we had a couple of 3s after that. So I'm going to revert back to Evelyn and Shara for mental health and ask them, was there something in particular that they wanted for adult committee to pick up and submit for the needs assessment? And we'll see how that impacts the choices on mental health, and then we'll come back and do the same thing with substance use. So Shara and Evelyn.
Hey, so oh, wow, so sorry. I'm actually in Evelyn's office now. So I think we are good with combining those two options for the housing.
Are you talking about the mental health side?
The mental health side, yes.
Okay. And you guys, you can have 2 options. You don't have to combine them. For the adult committee, you can have 2 options. So if you want to do both of those, you can. And then, so you wanted, so this was the housing. That was recovery housing, right?
Yes.
Looking at on the, okay, and that was adult committee. Did you guys get anywhere in your thinking on educating police, trauma education for police? Shall we leave that in, let's see.
That, I don't think that that's something that we want to prioritize right now.
Okay.
I'm involved in some other efforts with that. So I feel like there would be a duplication.
Okay, that's great. So I've got you for the recovering housing, and then what was the other one you were going to combine?
We were looking at the elderly, the housing for the elderly,
adults,
mental health, physical health.
Okay. So
That
guys,
option.
All right. So then what that does to the broader committee selection, because the adult supports was the top vote getter. So that leaves our top vote getters as a social engagement for adults with mental health issues. And then the same day access to outpatient, including non-traditional therapies. And then the next thing would be trauma education for the police department, because you guys picked up the recovery housing piece. So yeah, that's how that works. All right. And if and so we won't go. I just want to make sure that that's where we're at. We can come back and get our details in a minute after we do substance use. So right now, what I'm showing is social engagement as number 1 for the general committee, and same day access as number 2 for the general committee, with the adult committee picking up older housing supports for older adults and recovery housing for adults with mental health issues. And so those are the top 4 that we have aligned. Does the general committee, as a top 3, want to do trauma education for police? There were 4 people that had aligned with that.
Robin, I'm not sure I'm following. What do you mean by shall we do them? How are we going about this and selecting our final 2?
So we were asking you to do we were doing a top 3. We got that down. And then we pulled out the ones we had so that adult committee can use them. So they came out of our general selection, and which allows us, Elliot, to really have more needs identified that are going to be put forth, even if we pull it out of the general group. And
how does that work through that? This is new to me, so I'm just learning.
So Elliot,
how does the adult committee put that forward? For our region.
Do is we submit to mental health and substance abuse each as a general committee, and then the adult committee proffers two. They can do both substance use and mental health, and then the children's committee, and that all can get put in at the same time.
Oh, great.
Yeah.
So basically, you end up with, at the end, you end up with 8 recommendations, potentially 8 recommendations. So
Right.
you have mental health, you have substance abuse, you have children's committee, and you have adult committee.
Exactly.
I think at this point, we ask people to rank their top 3. So now I think it behooves us to have some discussion on those top 3 to see, of those, which ones, what would the group come up with as their top 2? And I think that's probably more of a discussion than just a straight vote. So, Robin, you want to kind of lead discussion on this?
Well, actually, Angie, can we do what I'd like to find out if adult committee has, I'd like to get that put away.
Oh, I'm sorry. I apologize. I'm jumping ahead of the game. No, I apologize.
No, that's okay. So, so I just wanted, we had given Shara and Evelyn time for some discussion there. And so, Evelyn, Shara, if you'll kind of put your heads together again. And so what we had for the substance use side was residential beds with social distancing as the top vote getter, and transportation, and then pharmacy discrimination, and expanding recovery housing. And so those were the top 4. So my question to Evelyn and Shara is, are there 2 that you would like to select as for the adult committee to pursue?
Just give us a minute.
That's different.
I'm sorry.
I feel like we're in a sci-fi movie. Usually that'll happen when you have a speaker on or you have an additional microphone going.
Yeah, so I'm in the room with Evelyn. I think that's the problem. I'm going to log off my phone, so we're just on her computer.
That's great. That'll work good.
The recovery house.
And guys, we really appreciate you working within this process. And Angie, I do feel like we're making headway.
It's a process. It's COVID. We're all learning.
We are. Yeah, and those of you that as they figure out what they're doing technically over there, those of you that were with us last year when we were in the big room over at TADIS, we split into 2 groups. We split into the substance use side and the mental health side. And each group came up with its derivatives, and I thought it worked out really, really well. Maybe next year we'll be doing that again. So, all right, guys, how are you coming technically over there? And Evelyn and Shara, you can use the chat box if you need to let us know. You can either go to everyone or to me or Angie. And I'm going to ask the group if they feel strongly about, obviously they do as far as residential beds for substance use with the consideration of social distancing. And that's an interesting one because with some hope, that'll be time limited. So the group may want to think about that because this will not go into effect until, Kirby, is it next July this would go into effect? Or is it later than that?
The needs assessments?
Yeah.
So they'll be used in the development of the FY22 3-year plan, which they start working on that in June.
Okay. All right, Evelyn and Shar, we're going to need some input from you guys. And otherwise, I'm going to. Can you hear me? Why don't you go ahead? Why don't you go ahead and use the chat box feature, which is you can click on 2 on the pane on the right on that window. And you can put you can put to everyone and let us know which issue you think you'd like to tackle or include for needs assessment for the adult committee. Or I tell you what, if you want, let's see. Chat. From Evelyn to everyone. Thank you very much. So I see that you are interested in doing the increase in recovery housing and transportation. So those are the 2 issues the adult committee would like to tackle, which leaves us on the substance use side. Yeah, okay. So that leaves us with the residential beds on social distancing and recovery and transportation. That takes that one off and that one. And that leaves us also with discrimination by pharmacists for MAT. Those would be the 2 top. So that's.
We really need to have, Robin, can we put the 3 top up there so we can have some discussion?
Sure. We're going to get into 6 because we have 3 that are tied at 3, none at 4, and 3 that are tied at 3. We have very strong top 2, but the next tier down is mixed. And that's into quicker access to outpatient, MAT data, and increasing case management.
Robin and Angie, I heard mention that the adult committee can submit 2 proposals, is what I heard. Is it one from each side, the mental health and A&D? And if so, does that mean they can take just one of these?
That's true. I mean, that's true. They could take, and we could, and you're thinking, Elliot, is that we take one of the issues they had identified into the large group
and consider it with the others, yes.
Okay. So I think that's fine if that, and hopefully that will work with Shah and Evelyn. And one of the things with somebody with some knowledge, talk about that transportation. Do you know anything about the transportation expansion, any of you? Because what I'm wondering if it goes into other counties, If it's outside of our county, I don't know that that's a recommendation we can make for Davidson County in our region. So I don't know.
Robin, I know that sometimes they do I can only talk about train care transportation, of course. Sometimes they do transport through counties, like they'll transport from Memphis to Nashville.
That's true. When you do have someone if there's not service available here. Okay. All right. So would the group like to take that one up as a general needs assessment rather than just the adults? Can I hear from you guys, or can I see a show of thumbs up?
Sorry, my phone rang. What's the question?
The adult committee has chimed in to say that they would like to do the transportation piece, and that leaves the recovery housing to the general group. So I'm gonna adult committee. Okay. All right. So Angie, to our top three, that brings us down to residential beds and social distancing, pharmacy prescription of MAT, and expansion of recovery housing. So that gets us our top three on SU. Okay. All right. Now we can have some time for discussion. And Tristan, just to let you know, I did get your notice. Thank you. Appreciate that. And so if we can get down in the next 10 minutes, if we can get us down to, we can kind of see if we can't winnow down to 2 on each side, that would be terrific. And I will start the discussion on that with mental health. So, so our top 3 for mental health are social engagement for people with mental health issues, the same-day access to outpatient therapies, and what's my other one? And they're doing recovery housing, and then the trauma education for police. Can we have some discussion on what you feel is important with each of those? Some limited discussion. And quite frankly, I'm going to speak to the social engagement for adults. We see this as a real barrier in recovery, that people, once they get hit with a mental health issue, there is such stigma, or they have been knocked back so far, they don't know how to engage. And I really do think this is something that is a need in recovery for our folks. Anybody else want to comment on that or add to that? All right, the next issue is same-day access to outpatient therapies, even non-traditional, that can be telehealth. Those of you that were in support of that, would you like to say something about that? Why do you think this is a need that we have in the mental health community?
This is Elliot. I did not vote for that particular item, but it relates to workforce shortage. And the reason I did not vote for it is we're not really close to being able to truly offer that. We have a lot of ground to cover before that can really be something that applies to everyone here in Davidson County. But the purpose behind it is good. And then we've had, I think, a similar need put forward in previous years. So, I mean, we just need to make sure that we have the resources to do it and make sure to offer that care. So it's about workforce, if you ask me.
Thank you, Elliot. And you also bring up another point. As we look at these needs, we also have to look, we'll be comparing them to the 3-year plan and see if they align with the 3-year plan. And then the other thing we have to look at is there going to be a big fiscal note to this? Because we know in this day and age, anything that does carry a big fiscal note is likely not to be looked at as seriously. So I just want to put that forth. I don't want that to stop you from making suggestions, but it's just an important consideration.
I think one thing on the this is Angie, I'm sorry. One thing about that though is that even if there's a need, if it has a big fiscal note, you know, one of the things we've been able to do year over year, if you go back and you look at the recommendations that we've sent up for needs, sometimes the department has been able to use that information to actually get resources to address those needs. If it's a consistent high need, unmet, unfunded, then that could give the department some leverage on, you know, where grants are gotten, or, you know, discussions with governor, whatever kind of thing. That was my understanding. And people, I don't want to speak for the department, but somebody from the department may want to just comment on that.
And I second that as well.
Angie, this is Avis. You're exactly right. And I do know that it is a concern, particularly this day and time as we speak with everything going on. But I think you make a good point that if it's something that the group as a whole really feels passionate about, adding that or keeping that on the needs assessment, even if it has a physical note or a large physical note, it is worth keeping that in mind and keeping it on the list if you feel strongly about it, because you never know when additional monies can come about, or like you said, grants that may be aside from state funding, maybe federal funding or local funding, anything, and that if it can be used for that. So I think that's a good point that you make, Angie.
And I'm going to chime in and appreciate that too. I've been doing this for a while, as some of us have with this group. And Suzanne Weed used to be the department's representative. And I remember year after year, we would talk about, we need children's beds. And we put that on the needs assessment for several years. And we finally started to get some children's beds. So I think that's an excellent point. All right. And does anybody want to? Yes.
This is Willie.
Okay, Willie.
Since I work out in the area dealing with all the individuals that we are trying to help, it is a very big need, and trying to get that information out to them and even trying to get them to buy into doing it, to step forth and have whereby employers also buy into it, puts this in a very high bracket. We might not get it at this point, but keep talking about it is greatly needed.
And just the fact that we're having this much conversation around this, when we've thrown out so many things and people have not engaged in this group today and other things, I think speaks loudly about it. I'm going to do, just for the sake of fairness, the trauma education for the police department. Is that something that people think is important or can even be impacted through this process? I don't know that we can engage this as a need. I mean, this is, again, a criminal justice issue, not necessarily, I don't think, in the hands of the, even though I know that, you know, different groups, I know I've been among them, I know MHC is among them. I know that we do some education with police departments, but, you know, do you want to see that as a primary need going forward?
This is Angie. I'll just speak from Davidson County. The Policing Policy Commission had some real strong recommendations that Chief Drake is actively pursuing around this issue. So, you know, I think it's fine for us to say, you know, that this is a need. I do know that there is a concerted effort to address this in Davidson County. So if we're talking about Davidson County needs, we could certainly, you know, put 3 of them up there and explore it if you want to, but I just didn't want us to spend time on it if the group I just want to provide that information as background for the group in the discussion.
I'm with Angie. I'm involved with some things, and there are other groups that are involved with some things. I think this is being addressed. I think this is in process.
I'll piggyback again. In Tennessee, Davidson County is going after a grant for CIT to become a CIT program, hopefully with Fidelity, and they expect to get that within the next year. Of course, it's a competitive grant, so anything goes, but that's important. And I also know that Chief Drake has engaged with some local groups regarding co-responder services or community responder services for mental health crisis response. And I do think that is the bigger of the needs here in our community. There's no guarantee that's going to move forward. So if the group feels this is a big deal, I would suggest to look at the community or collaborative co-response type models.
Thank you. All right, given that bit of discussion over these, we're back down to the social engagement and same day outpatient access as the two that seem to be the primary. Now, guys, and Angie, you can chime in with me here. And I am going to go on to substance abuse, do the same thing. But what I want to say is we're coming very close to the end of our time. We are and bye, Tristan. I know you have to go. Thank you very much for joining us today. And so, we're not going to get this done. I would like to know, because as Elliot and Angie both know, this ends up falling back on the committee chairs who are just as time stressed and strapped as you are. I would like to know if we have some volunteers that are available. And Evelyn and Shara, I know you've got the adult committee. I'm not calling on you. But I'd like to know if we have some volunteers available to help take this process further, because there is further process to do with these. And do we have 2 or 3 people that would be willing to come together and help us flesh this out? And we will inform you as to what that means. Do I have any hands that would be willing to do that at a time convenient to the group? Whoever comes together. And I know this is just your full heart's desire. Thank you, Rusty. Anybody else that really wants to get on a limb and have an exciting day of discussion? And it won't be a day, I promise. I don't have a day. So neither do you. Anybody else that wants to be able to share an hour to an hour and a half more on this to get it finally woven so that we can get it submitted. I just don't see those hands going up. All right, I may thank you, Rusty. You are duly noted, and we'll see if we can get maybe a few other volunteers.
Robin, it looks like I saw, I hope I'm saying this right. Correct me if I'm wrong. Evelyn and Shar put their name down to also be a part. If I'm incorrect, ladies, I see.
Oh,
I see that. I see, yeah, in the chat. If I'm wrong, ladies, just let me know. I'm not trying to single you out, but I saw that you put your names there. And
actually, what I think I'm reading where I see please join us from Evelyn to everyone is the adult committee would also like some assistance in doing that. And you know what, Evelyn and Char, what we may do, and Rusty, it might just behoove us to get together to do them all together at once, because I think there's going to be overlap, and I think the information shared and the data shared can probably help everybody. So we'll look at getting that together.
I think I misspoke, Robin. I didn't see the please join us. That was after that they said. So maybe they're saying please join us with the adult committee. I'm not sure. If so, I apologize if that's an error.
That's okay. Thank you very much, Avis. And so let's identify. Angie, this is where I'm going process wise, and if you think different, please say so. But let's identify our top 2 for substance use. We know the adult committee is going to take on the transportation issue, and that leaves us the 2 top issues, like I said, for discussion. The 2 top issues were the residential beds and expanding recovery housing. And again, we had quicker access to outpatient, MAT data, and increasing case management. Out of those, let's see, is there anyone that would not want to have residential beds for substance abuse with acknowledgement of social distancing? That was the number one vote getter, and then we can talk about the other ones. Is everybody good with that?
I think that makes sense. I would not encourage a focus on the social distance as a core element there, for it to potentially be dismissed after pandemic gets closer to resolving itself.
That's what I was thinking too. So pharmacy discrimination with MAT, there were 5 of you that said that was important to them. You know, so that's a big issue. How do you see that as, do you see the issues of quicker access to outpatient, or information on MAT data development, or an increase in case management as equally important or any more important than discrimination at a pharmacy level for MAT?
I think we need recovery housing is very important, especially recovering housing facilities that will take, or homes, I should say, that will take anybody regardless of whether they're on MAT medications, for example. That is, I think, getting somewhat better, but still a need. And there's just not a lot of these housing facilities in our urban Davidson County area. We're getting folks on both the mental health and the addiction side pushed out of the community because these landlords cannot afford these units. So I think pharmacist discrimination against MAT clients is huge. I've seen it. This is something I'm passionate about personally, but really it ties into me that people just need access to these services and without being discriminated against. So I think the department's role, if you're looking at the pharmacy piece, could be in educating, providing some education or a program of education for pharmacists and those involved there. They are not really directly involved together, as far as I know. And on the recovery housing, I'd ask others to speak, but I hear that all the time. It's just a huge need.
I do too. Andrew, you think would be appropriate to do maybe a show of hands over the 2 issues?
Yeah, that's fine.
Okay. So how many people would choose as our second issue the expansion of recovery housing? Please use your reactions. Jennifer. Okay. So I think I saw 6. And anybody correct me if I'm not correct there. And then how many would prefer
On the phone, Robin.
Oh, thank you. And on the phone, who else? Who on the phone would see the expanding recovery housing as something of more importance to them over the pharmacy discrimination? Anybody? Okay, thank you. And then how many? Evelyn, thank you. Okay. How many see a more important issue to be discrimination, from pharmacists around MAT? Okay. All right.
Hello, this is Rama.
Yes, Rama.
I was going to vote for the recovery homes.
Mm-hmm. Thank you, Rama.
I was talking, so thank you very much.
Okay, thank you very much, Rama. All right, I did see one person for the pharmacy discrimination. I think that was Kubra. And is there anybody on the phone that's more concerned about the pharmacy discrimination? All right. All right. It's pretty clearly strong that expanding the recovery housing and the residential beds.
I think that'll give us the better chance at the department paying attention to it. And I don't think it'll be as easy. I abstain from the vote, honestly. They're both very important, but in this context, I think this is the right decision.
Thank you, Elliot. Appreciate that. All righty, guys, we are getting, actually, we are at time, to end our meeting. What I would like to do at this time is to encourage you to join the legislative committee if you have an interest to do that. I want to thank you so much for your time with us today. We do this every year, and those of you that have been with us a long time know this is a process that we go through every year, and it's an important one. It really is, it's a time to let voices be heard. And I want to thank Angie and Julie Thacker, who had previously assisted us. We are not done. There is still quite a bit to do. And I want to thank Evelyn and Shara for taking on the adult committee stuff. Before we go, I just want to, Rusty, if you can, we'll do a quick roll call, and so that it's on the official recording, so that if anybody joined afterwards, you can get it. I know we've lost one, but I'm showing, I'm just going to go through and say it so that you got it. Robin Nobling, Amy Holland, who is actually Kirby, Jessica Singer, Cooper Urkel Bryant, Avis Easley, Elliot Pinsley, Rusty Todd Emerson, Angie Thompson, Evelyn Yergin, Heather Vestal, Rama Mohammed, Sharon Ross, Susan Mee, Jennifer Jones. Am I missing anybody? Is there anybody I haven't called? I know we've had more. Right.
I know there was a Bry that was on earlier, but I did not catch the full name of who that was.
That is actually Bria Young, and that is my intern. And
okay.
She was having some kind of difficulties. And then Tristan had to get off earlier, but I appreciate that.
And Shara is also joining via Evelyn's office.
Yes,
Shara,
thank you. I don't know if she was in earlier. Thank you, Evelyn and Shara. All righty. Thank you all for your participation. We will be going out and getting the group together to get this narrowed down so that we have it by our deadline. If you have any announcements or anything that you would like to share, we're getting off today. I had something that I was going to share, but I think I'm going to pass just in the sake of time and just going to thank you all for your participation. All right. Take care. Bye-bye.
Yeah. Bye.
Bye.
Thank you, Robin and Angie,
Thank
as
you.
always.
All right.
Bye.
Thank you.
Robin.